Hi everyone, Dr. Nemechek here. I want to talk about celiac disease and the potential problems you might have after you've eliminated gluten, but you still don't feel like your gut's better. Okay, there's two other things you have to consider. All right, first, celiac disease is an autoimmune disorder where your immune system is attacking the cells that line your small intestine. And it is a reactivity when you have gluten, which is from flour mainly, flour-based products in your diet. Okay. Now, so the standard approach, if you quit gluten, get rid of it all out of your diet, you don't have anything that the immune system will react to, and then your brush border here, where you absorb everything, will heal up and normalize, and your symptoms go away. But some people, their symptoms don't go away, and that's because one of the big things that happens is a lot of people with celiac also have SIBO. All right, so you have two things that are disrupting your gut. Okay, and that can occur up front when you just screen a whole bunch of patients. So this is the incidence of SIBO in different studies. So here's celiac disease. So anywhere 10 to 30% of people with celiac also have SIBO, bacterial overgrowth. All right, and it's interesting. I mean, you look here, diabetes, 29%. Okay, have SIBO. So SIBO's pretty. Here you take PPI intake. You take Prilosec all the time, 10 to almost 43% have SIBO. But anyhow, back to the point. 10 to 30% have SIBO. Okay? There's another problem in addition to this potential thing that can be doing it. And I've discussed this in the videos about how COVID damages your intestinal tract. And so here we have, this is that barrier. And what happens, so when you eat gluten and you have celiac, you'll get inflammation along here and it'll damage these cells, okay? So then, as I said, 10 to 30% of patients also have SIBO. And, I should also add, after treatment, so if you still have symptoms, the probability goes up to about 60% have SIBO. Okay, and I'll put paper references in the discussion notes. And then COVID causes a high level of inflammatory stress. This creates a deficiency in an amino acid glutamine, and this also causes the gut not to function well, high levels of inflammation here, okay? This same glutamine deficient kind of damage to the gut also occurs in celiac disease. All of them, we don't know. Probably not. But the point is, if you have celiac, you cut back your gluten, you're doing a little bit better, but not as well as you could, and you're pretty certain the gluten's not leaking in through some little reactivity, you have either SIBO and or this glutamine deficiency problem here, okay? So, celiac treatment, avoid gluten. If you're 100% better, great. That's all you got to do. If your gut's better, but you have some neurological stuff, maybe some autonomic dysfunction, a little lightheadedness, or you got some arthritic stuff going on, you still might have leaky gut. Okay? And I would recommend, treatment of SIBO, and that's just Rifaximin twice a day for 10 days. Take a measure of that, see how you're doing, see how your symptoms are. And then I would also do treatment for that glutamine deficiency, leaky gut that's caused by the inflammation. Here it's just L-glutamine, 15 grams. You put in a little juice or water twice a day. Buy it off of Amazon. I recommend the Now Sports brand. They're like Now Foods has a sports division, Now Sports. So this is, I think, a more complete way to view the problems of celiac disease, the inflammation that can be triggered by that, and these other two kind of tag-along problems that actually a large number of patients with celiac have. So I hope that's helpful to everybody. Remember, hit the subscribe button. Go to nemechekprotocol.com for your fish oil and olive oil. And if you're looking for a vagal stimulator, go to vitalitysmartcable.com. Everybody, have a great day. Take care.